Walking begins to fall short after 75 because the joints no longer receive the support they once had, and many seniors notice the change quietly during ordinary moments. Orthopedic surgeons often explain that when muscles weaken with age, walking alone cannot protect the knees, hips, and lower back the way daily, targeted movements can. The body needs a little more than steps to stay strong, steady, and pain-free. That is why experts now recommend a simple, daily routine designed to strengthen the joints from every angle, helping older adults move with more confidence, comfort, and lasting stability. If staying strong and steady after 75 matters to you, consider joining this community where simple guidance can make daily movement feel safer and more comfortable. Subscribe to stay connected, leave a like to support senior wellness, and share your experiences in the comments so others can learn from your journey towards healthier joints. Item 1. Daily gentle strength training. Daily gentle strength training supports the joints in ways that walking cannot, especially after 75, when muscle tissue naturally thins and offers less protection to the knees, hips, and lower back. Orthopedic surgeons often explain that aging joints depend on the surrounding muscles to absorb pressure, stabilize movement, and prevent unnecessary strain. When those muscles weaken, even simple walking can feel heavier, less steady, and more uncomfortable than it once did. Gentle strength work restores the support system around the joints by encouraging the muscles to become active again without overwhelming the body. Light resistance exercises, such as slow leg lifts, seated squats, or carefully guided band work, help strengthen the quadriceps, hamstrings, hips, and core, allowing the joints to move with better alignment and less friction. Some doctors point out that even small improvements in strength can reduce pain and increase mobility more effectively than increasing daily steps. These controlled movements give the body the stability it needs to handle everyday tasks, from climbing stairs to rising from a chair, with noticeably greater ease. By practicing gentle strength training each day, the joints receive a cushion of support that walking alone cannot provide. This routine encourages healthier movement patterns, steadier balance, and a more confident stride, helping seniors feel capable and protected during activities they enjoy. Item 2. Controlled balance exercises. Controlled balance exercises become essential after 75 because walking alone does not challenge the stabilizing muscles that keep the body steady. Orthopedic surgeons often explain that the ankles, hips, and core gradually lose their ability to react quickly, making the joints more vulnerable during simple tasks. When balance weakens, every step places extra pressure on the knees and hips, increasing the chances of discomfort or sudden falls. Gentle balance work strengthens the small, supportive muscles that walking rarely activates, allowing the body to stand, shift, and move with greater control. Simple daily movements, such as holding a supported single-leg stance, practicing slow heel-to-toe walking, or shifting weight from side to side, help retrain the nervous system to respond more effectively. Doctors often point out that these exercises teach the joints how to stabilize themselves before the foot even leaves the ground, reducing the risk of missteps. Strengthening these underused muscles brings a sense of steadiness that walking cannot build on its own. Regular balance practice restores joint confidence, allowing seniors to navigate uneven surfaces, climb steps, and turn corners without hesitation. It improves posture, reduces joint strain, and makes everyday movement feel smoother and safer. With daily balance exercises, the joints learn to work in harmony again, offering protection and security with every step. Item 3. Low-impact mobility routine. A low-impact mobility routine becomes increasingly important after 75 because walking moves the joints through only a narrow, repetitive range that is no longer enough to keep aging cartilage healthy. Orthopedic specialists often explain that joints depend on gentle, varied motion to stay lubricated and nourished, allowing the tissues to glide smoothly. Without this variety, stiffness builds, movements become restricted, and even short walks can feel heavier on the knees, hips, and lower back. Mobility work reintroduces slow, controlled movement that supports the natural fluidity the joints need. Daily mobility exercises, such as gentle knee circles, slow hip rotations, or ankle flexing, help bring fresh circulation into the joint spaces. These actions reduce stiffness and encourage the surrounding tissues to relax, creating a more comfortable foundation for walking. Some doctors emphasize that mobility routines help retrain the body to move with smoother transitions, reducing unnecessary strain that develops when joints stay in one pattern for too long. Practicing low-impact mobility each day prepares the joints for the demands of daily life by keeping them supple and responsive. It enhances comfort during ordinary movements, supports better posture, and allows seniors to enjoy walking with less pressure and more ease. By giving the joints this gentle attention, the body gains the flexibility it needs to stay active and confident. Item 4. Hip and glute activation movements. Hip and glute activation becomes essential after 75 because weak muscles in this area shift pressure onto the knees, ankles, and lower back. Many orthopedic surgeons explain that when the hips and glutes do not properly engage, the joints below them are forced to absorb more impact with every step. Walking alone rarely activates these deeper muscles enough to protect the joints, leaving older adults more vulnerable to discomfort, instability, and fatigue. Daily activation work strengthens the foundation of the body so the joints can move with better alignment and support. Gentle exercises such as seated leg presses, controlled side steps, or slow glute squeezes help reawaken muscles that often become inactive with age. Doctors frequently note that these movements improve joint positioning, allowing weight to be distributed more evenly during walking or standing. This reduces strain on the knees and ankles while also easing tension in the lower back. Even a few minutes of focused activation can make the joints feel lighter and more secure. With regular practice, hip and glute activation restores strength where the body needs it most. It enhances balance, supports smoother walking patterns, and gives the joints a stronger base to rely on throughout the day. This simple routine helps seniors feel more stable and confident as they move through daily activities. Item 5. Avoid long, unbroken walking sessions. Avoiding long, unbroken walking sessions becomes important after 75 because extended periods of repetitive movement can place heavy stress on joints that no longer recover as quickly as they once did. Orthopedic surgeons often warn that while walking is beneficial, doing it without breaks may strain the knees, hips, and lower back, especially when the surrounding muscles are not strong enough to offer full support. The body responds better to shorter, structured intervals that protect aging joints from overload. Many experts explain that continuous walking increases the risk of swelling and irritation, which can make the joints feel stiff or unstable afterwards. Breaking the activity into smaller sessions allows the muscles and tissues time to rest, preventing the kind of overuse that often leads to discomfort. Even a brief pause gives the joints a chance to reset, improving the quality of movement when walking resumes. Shorter, planned walking periods also encourage better posture and more mindful steps, reducing unnecessary strain caused by fatigue. Some doctors note that these intervals help seniors maintain steadier balance and fewer compensating movements, which supports joint alignment. By avoiding long stretches of nonstop walking, older adults can enjoy the benefits of staying active without placing excessive pressure on their joints. This simple adjustment helps protect comfort, mobility, and confidence in daily movement. Item 6. Daily light stretching for joint flexibility. Daily light stretching becomes essential after 75 because the muscles and connective tissues naturally tighten with age, placing extra pressure on the joints. Orthopedic experts often remind seniors that stiffness restricts movement and forces the knees, hips, and lower back to work harder during simple tasks. Walking does not lengthen or relax these tissues, which means the joints continue to face unnecessary friction. Gentle stretching restores the flexibility needed to keep the body moving comfortably and smoothly. Slow, controlled stretches for the legs, hips, and lower back encourage better posture and reduce the tension that builds throughout the day. Some doctors explain that stretching increases blood flow to the muscles, which helps them support the joints more effectively. Even a few minutes of gentle movement can make everyday actions like standing, bending, or turning feel easier and less painful. Stretching also helps prevent the stiffness that makes walking uncomfortable, allowing the joints to glide instead of strain. Practicing light stretching each day helps maintain mobility and reduces the burden on aging joints. It prepares the body for daily activities by improving flexibility, easing tightness, and supporting natural alignment. This simple routine brings a sense of ease and comfort in movement, helping seniors stay active, steady, and confident throughout the day.